Today we will discuss about the clinical based question related to the fracture of the humerus. A man have epilepsy lead to fall from standing, lead to proximal humeral fracture. Which are the nerve damage at different level of fracture of the humerus, which are the artery along with the nerve in relation to the humerus, and explain the clinical aspect of the supracondylar fracture of the humerus. The artery and nerves related to the fracture are the first one is at the level of the surgical neck of the humerus. There is a axillary nerve and the posterior circumflex humeral artery. So if the axillary nerve damage, it lead to it supplies to the mainly deltoid and teres minor, so it lead to there is a loss of abduction and rounded counter of the shoulder which is lost. The fracture of the mid shaft fracture, it lead to the potential damage to the radial nerve and there is a profunda brachii artery. If the radial nerve which is damaged, it lead to the all the muscles of the arm, back of arm and back of forearm, mainly which is paralyzed if the radial nerve injury. The another is the supracondylar fracture of the humerus, and supracondylar fracture of the humerus, it is the potential site for the damage of the brachial artery and median nerve. If there is a median nerve will damage, it lead to there is all the muscles of the flexor of the forearm which is paralysis, and along with it there is a thinner muscles which is also paralysis, and the lateral 1 and 3.5 fingers which is the sensations, cutaneous sensation loss because the cutaneous innervated by the 3.5 fingers on the lateral aspect by the median nerve, and the fracture of the medial epicondyle, it lead to there is a potential site to the damage to the ulnar nerve and there is a ulnar collateral artery. So the ulnar nerve damage, it lead to there is all the intrinsic muscles of the hand which is damaged. So mostly 15 muscles of the hand which is supplied by the ulnar nerve, mainly the dorsal interossei, palmar interossei, hypothenar, and second, third and fourth lumbricals which is supplied by the ulnar nerve, it lead to damage to the ulnar nerve, it lead to there is paralysis of these muscles. If there is a supracondylar fracture, the immediate complications, it is lead to there is a vascular insufficiency, and the pink pulseless hand involvement of the brachial artery is most commonly associated with the supracondylar fracture. Another is the compartment syndrome. It occurs into the 0.1 to 0.3% of the cases associated with the forearm fracture, and elbow flexion increase the 90% compartment pressures. Neurological deficit which is present into the 10 to 20% of the supracondylar fracture, and open or associated forearm fracture will be also will be possible to occur. The long-term complication, it is a cubitus varus deformity. It occurs due to the malunion and also known as a gunstock deformity. Post-traumatic cubitus varus deformity has an important problem which is associated with the tardy ulnar nerve palsy. The another is the Walkman ischemic contracture. It is a compartment syndrome is not treated timely. The associated ischemia may progress to infarction and subsequent development of the Walkman ischemic contracture. Fixed flexion of the elbow and pronation of the forearm, flexion at the wrist, and joint extension of the metacarpophalangeal joint. So this will occur inside the Walkman ischemic contracture. So inside the Walkman ischemic contracture, there is a damage to the brachial artery in supracondylar fracture. It lead to ischemia leading to contracture of the long flexor and extensor into the forearm. Result lead to the claw hand, wrist flex, bulkier flexor, therefore more contracture, and extensor of metacarpophalangeal joint because of the insertion of the extensor tendon into this joint. Flex interphalangeal joint because the insertion of the long flexor tendon into this joint. So this is about to the fracture of the humerus and nerve and artery damage along with the fracture of the humerus and detail about the supracondylar fracture of the humerus. Thank you.